afternoon, everyone. Thank you so much for joining us today with our first Lunch and Learn. It was very excited to see how many people registered and were supporting us with this new series. So thank you so much for taking the time. I wanted to, I want to piggyback a little bit off of what Carissa was saying. I do have one of my colleagues, the other clinical supervisor within the Credentialing Support Partnership in this Lunch and Learn today. The Nick Pfeiffer, he will be available to answer any questions that I don't get to quickly enough due to the time constraints of our Lunch and Learn. And at the end, we are going to pull all of those questions together. And my hope is to create a document to send out as a follow-up to any questions that you have or anyone else has, maybe that was already answered or we didn't get to. Throughout the training, I do have moments to pause and for us to ask any questions. And it'll just depend on time if we have the time to answer all of them or not. The other side is I wanted to give a little bit of background of why we chose this topic today as our first Lunch and Learn. Part of my role as the clinical supervisor with the Credentialing Support Partnership, within it, I'm seeing a theme, a couple of themes within our community. Some of them stem from individuals not knowing what degree is eligible for receiving the credential of a LADAC or an MLADAC. We're seeing that in their clinical supervisions that the rules and laws are not shared or talked much about. And so we really wanted to create this quick Lunch and Learn to go through those rules and laws to update folks. I see that there are several I would say people, well-experienced clinicians that are joining us today. So, my hope is that you're picking up on some of the new changes within the rules to share with your supervisees if you're in a supervisory position. But that's a little bit of a background while we chose this particular topic to start off with our Lunch and Learn. Today's objectives, so quite a few, so a lot of material to get through. Number one is to explain the credentialing requirements to become a LADAC, the credentialing requirements to become an MLADAC, the renewal requirements for maintaining the LADAC and MLADAC. My hope is to give information on how to identify an approved supervisor for both the LADAC and MLADAC credentials, and how to become an approved supervisor for those credentials. I do want to give a disclaimer that some of this material can be very dry. So I do want to try and bring a little bit of humor in here and there, or to, to bring some more information that is not completely described in the rules. But yes, there are a lot of rules and laws we're going to go through today that will be very wordy. And if there's any kind of questions after this and you had some time to digest, please reach out to anyone at the Credentialing Support Partnership, myself, Nick Pfeiffer, or Erin Majory, and we could be happy to help you with any questions that you have following this Lunch and Learn. Wanted to start off with some workforce development stats. So every year or every 2 years, when a LADAC or an MLADAC renews their license, they are asked to take a survey. And those results of the survey are put together to provide a report of workforce development within our state. So what are the needs? Where are some areas that we need to focus more on? How can we really build more LADACs and MLADACs to meet the needs of our community. So I wanted to bring some of those stats out. In the 23 annual report, they pulled the numbers from 2020 and 2021. And in those years, there was only a 6.3% net change in LADAC and MLADAC providers. So there were 507 eligible to renew within those years. 47 providers were lost, so they were inactive, they didn't renew their license or got revoked or anything like that. So 47 providers were lost. 79 providers were gained. So that's all the new initial LADC and MLADCs within those years. The average wait time for new clients during that time period was reported between 6 and 10 days, and 5 and 7 days for routine appointments. Any wait time we know is too much. I will say that within the report, it does mention that alcohol and drug counselor providers are getting clients in, new clients and routine appointments faster than any of our other providers, such as mental health providers or psychologists. So yes, we are getting them sooner, but still wait time. We want to see how we can enhance and get them in even sooner. There is a 13.9% anticipation of a reduction in practice over the next 5 years with alcohol and drug counselors due to taking those reports from the survey, people saying they are going to go, into retirement, or they're going to reduce their hours for whatever reason. This was taken into account, and 13.9% within all levels of care. They did pull out outpatient level of care, and that's 14.2% of just outpatient level of care providers anticipate to reduce their practice over the next 5 years. In rural New Hampshire, alcohol and drug counselors are more likely to hold a LADC versus an MLADC and be older than 54. So our median range right now, or around the time this survey came out, was 54. So a lot of anticipation of people retiring, and we need to see how can we get more LADCs and MLADCs initiated into practice to overcome those that are going to be leaving us due for whatever reason. So workforce development is something that we are specifically targeting and with our credentialing support partnership. These were some numbers pulled over the last year, so about 16 months. You can see the different LADCs and MLADCs that were current and active. These numbers were pulled from the OPLC license lookup and from also that data collection with the Health Professions Data Center. This is our reference for today's Lunch and Learn. I wanted to provide the website for where you can go on yourself and do your own research and look at these rules and laws that we're going over today. The Board of Licensing and Other Drug Use Professionals is the specific name. We will be referring to that as the LADC board throughout the training, just to reduce saying the full name. But the Board of Licensing for Alcohol and Other Drug Use Professionals, you'll find on the OPLC site. This is what the LADC board site looks like. On the left-hand side is the home page. I circled so you can see there the laws and rules area. That's where you can click and find the second page, which is here shown on the right-hand side. It'll bring up this page. Governing laws are the RSA 330C. Those are specific to our board. The rules are ALC 100 through 500. I want to bring attention to the recently adopted rules. So these were just posted within the month, and these go into effect in October. So October 7th, they go into effect. We're going to talk about these throughout the training today. When you are looking at any of the ALC 400s, especially after 10.7, you really want to make sure you're looking at this link, because if you go to the link before, it'll give you the old information. So if you're looking for the new recently adopted rules that go into effect in October, you'll want to click on that link to get the most updated rules. All right, so we're going to start with the governing statute, RSA 330C. We call these governing laws. So the laws trump the rules. Within these laws, if you go to the website, you're going to see lots of different sections here. We're only going to look at 10 and 11, which is the scope of practice for LADCs and MLADCs. but you will see other areas of initial licensure, all of the other credentials that fall on the LADC board, such as CRSWs and LCS. On top of the LADC and MLADC, you'll find all of the governing statute laws that refer to those credentials. So RSA 330C the purpose is to protect and benefit the public by setting standards of qualifications, education, training, and experience for those who seek to obtain a LADC board credential. To promote competency in alcohol and other drug use, prevention, intervention, recovery, and treatment and co-occurring disorder treatment services. So as mentioned, these govern CRSW, LADC, MLADC, and LCS credentials. So the first one that we're going to look at is Section 330C10, and this is the scope of practice for an MLADC. I think it's important to know your scope of practice. So this we're talking about, so you want to be an SUD counselor. So let's look at the scope of practices. What do each of these credentials say you can do? What's within the scope? So we're going to start with MLADC. This scope of practice was recently updated in October of 2023. So almost exactly a year ago. What I've highlighted here are the areas that were added to the scope of practice. So as of October of last year, the scope of practice of an MLADC is a screening, assessment, diagnosing, treatment planning, treatment of substance use disorders, added mental health disorders, and co-occurring disorders. Very important piece to expand our scope of practice. It helps with the continuum of care within our alcohol and other drug use professionals and our community and our clients. Prior to this change, for people who don't know, prior to this change, an MLADC was only able to provide treatment services and diagnosing for substance use disorders and co-occurring disorders. So what that meant is if an MLADC was the only credential held, if both of those, if the substance use disorder went into remission, the individual, the professional needed to refer the individual out to a different clinician who could provide the mental health services if there was still an underlying mental health that was active. Here now, an MLADC is able to continue that care with their client. They do not have to or need to refer out. The practice of alcohol and drug counseling and co-occurring disorders includes performance areas that encompass the 12 core functions and practice dimensions of addiction counseling. Scope of practice involves the performance of clinical evaluation, screening, assessment, diagnosis of a substance use disorder, mental health disorders, and co-occurring disorders, and the performance of diagnosing and differentiating diagnosis. This includes severity assessments and assessments of dangerousness to self and others. An MLADC's performance is in treatment planning, case management, consultation, education, documentation, and client advocacy. The performance of counseling includes individual, group, family, significant other counseling, crisis prevention and intervention, co-occurring disorder counseling with the use of integrated models of assessment, intervention, and counseling techniques with or without the context or treatment of a substance use disorder. Scope of practice in MLADCs adhere to a professional and ethical standard as determined by the board. Our code of ethics for MLADCs is found within NADAC Code of Ethics. An MLADC may engage in independent practice with the scope of practice in the section only with clinical supervision or peer collaboration. We'll speak more towards that here in a little bit. An MLADC shall provide services only within the boundaries of his or her competence based on education, training, clinical supervised work, experience, consultation, study, or professional experience. And you see down here the sources. This is all the different times these have been changed, and the most recent, like I said, was October 3rd of 2023. Next, we'll jump over to the scope of practice for LADCs. So this is 330C11, the scope of practice for a LADC. One of the biggest differences between an MLADC scope of practice and a LADC scope of practice is here where it's highlighted. The scope does not include the treatment of co-occurring disorders. unless the LADC is in an academic internship as part of a master's program in a mental health field or employed as a LADC and working towards mental health licensure under, and it gives the other, the laws there. So a LADC scope of practice strictly is within SUD treatment diagnosing. With that said, they are able to provide the development of a preliminary mental health disorder diagnosis for further assessment and confirmation by an appropriate professional. So during their evaluation, which includes screening, assessment, diagnosing of an alcohol and other drug use disorder, assessment and identification of symptoms of co-occurring mental health, that's when they can come up with a preliminary mental health disorder diagnosis and then refer them to the appropriate professional to assess further and confirm that diagnosis. LADCs perform treatment plans, referrals, case management, coordination and implementation of treatment plans, consultation, coordination of care within the mental health and other community providers, ongoing assessment of progress and needs, and client advocacy, education, and documentation. Performance of counseling, same as an MLADC, individual, group, family, significant other counseling, crisis prevention and intervention. LADCs adhere to professional and ethical responsibilities as determined by the board. And here's another difference between MLADCs and LADCs. So a LADC may engage in practice only under clinical supervision of an MLADC, LCS, LADC, psychiatric APRN, or licensed mental health provider approved by the board. So a LADC must continue in supervision by an approved supervisor to maintain their license, and they can only practice with that clinical supervision. All right, I'm going to pause there. Any questions about the scope of practice of a LADC or an MLADC at this point? Okay. All right. Moving right along.
I was just wondering. Sorry.
Go ahead.
You said under supervision. Does that mean just supervision outside of the office or actually in the session with clients?
Right. So weekly supervision. So we will cover what supervision looks like and the requirements of supervision here later in the training. But what that means is weekly supervision. So an hour once a week of supervision.
Right. Thank you.
Does that answer? You're welcome. All right.
And Heather,
so I put two. Oh, go ahead. Yes.
Lucille had a question as well.
Dottie.
Hi. Can a license, just a LADC, LCS, supervise an MLADC?
An LCS, so a licensed clinical supervisor.
Yes, a LADC.
So yep. So an LCS is a separate credential that a LADC, if they held an LCS as well, so if they have a LADC and an LCS, they are eligible to supervise LADCs and MLADCs.
Thank you.
Heather, I have a question.
Yes, sure.
There's still a number of LADCs who have been grandfathered in since the changes took place in 2008 that can do not need the requirement of clinical supervision. They can do peer collaboration.
Yes, and that still stands. Yes, absolutely. And that'll be in our upcoming slides. We're going to get to that information here, but that has not changed. Thank you for pointing that out.
And I would check the that question on the LCS. My understanding has always been you cannot supervise above your level of licensure.
Okay, I will check. I will check on that for you. I don't know, Nick, do you have information on that you would like to share as we're here?
I was actually double checking it while we speak, Pete, for you. So I'll let you know ASAP.
Great, thanks.
Great. Thank you so much. All right. So I have some emojis here that, yes, sometimes these administrative rules can be frustrating. And at the same time, they give us lots of great information referring to becoming an SUD counselor, obtaining and maintaining LADAC and MLADAC. So it's frustrating when we're first looking at it sometimes, but it is also rewarding to look back and be able to understand, decipher, and see, what it is I really need to do in order to obtain and maintain. So I want to feel a little bit of both of those there. Administrative rules, so they are divided out into categories 100 through 500. Most recently, the 200 rules were actually repealed, and OPLC, the Office of Professional Licensing and Certification, has taken over the ALC 200 rules and the procedural rules. And in a nutshell, what that means is that they take oversight in providing licensing and certification and any sort of complaints that are brought up. So that is the now OPLC's jurisdiction and responsibility. Today, we're going to just focus on ALC 300 and ALC 400. These are specific for obtaining and maintaining a LADAC and an MLADAC license. So initial credentialing are your 300 rules. So ALC 300 is what you're going to look up if you're referencing these on the website. ALC 300 refers to initial credentialing. They describe the requirements for licensing and certification, describe definitions, requirements for applicants, eligibility requirements, application procedures for all of the credentials, explains exams that are needed, reciprocity, endorsement, additional materials to submit with the application, talks about the supervision agreement. The current version of the 300 rules did go into effect last year, March 13th of 2023. And we'll talk more here about what changes specifically we need to be aware of for the LADAC and MLADAC credentialing. The ALC 400s speak towards renewal requirements, also speak a lot towards supervision requirements for each credential. So describes re-licensure, peer collaboration, supervision requirements for each credential, how to be an approved supervisor when working towards credential, also describes an inactive and reinstatement process. The current version of the rules went into effect in July of 2018. However, like I mentioned earlier, there have been newly adopted rules posted on the website, and those will go into effect in less than a month, so October 7th of 2024. For the purposes of today's training, I did decide to speak towards those newly adopted rules. The thought of is that majority of folks are working towards gaining their licensure. We want to look at that, look at what things over the next course of the couple of years as you're obtaining that, what you need to look at. If you are looking to apply before 10/7, you would use the current ones that are already in active the current version that are already active. You could find both of those on the website. Just make sure if you're looking for the newly adopted ones that you click on the new link that specifies all of the new documentation, excuse me. All right, so initial credentialing requirements. These are, again, the ALC 300s. For the LADAC requirements, we're going to start with the licensed alcohol and drug counseling requirements for initial credentialing. Education, so important. We're seeing within our program folks coming to us not knowing what degrees qualify, or they may have thought they had a degree that qualified. Maybe they didn't know they had a degree that qualified. So I want to start off there with the education. So LADAC requirements: associate's degree in addiction studies or substance use counseling, bachelor's degree in clinical mental health, social work, psychology, substance use counseling, addiction studies, human services, or equivalent. So that or equivalent is a gray area. I'll be open about that. If you have a degree that does not specifically fall under what is written, does not mean you're completely out of not holding an eligible degree. It just means that you will need to take further steps to show to the board or OPLC that your degree is equivalent to one of those that is mentioned. There is a process of that. And if you find yourself in that need, you can reach out to our staff and we can help support you with looking into that. Another requirement is 300 hours of substance use education. So this can be part of your degree. So any classes that you took that were specific to substance use treatment or diagnosing, that can be utilized. If you are using your college credits, one college credit equals 15 hours. Most college credits are about 3, or most college courses are about 3 credits. So then that's about 45 hours you already have if you can use some of your college courses. Other ways that you can obtain them is through other pre-approved training facilities, just like NAHADICA. We have a plethora of trainings that meet the requirements of these education and CEU requirements. Within that 300, as you see on the right-hand side, these are requirements that are specific and necessary within that 300. So 6 hours of ethics, 6 hours of confidentiality. So both of those as it pertains to substance use. So you want to make sure confidentiality is around 42 CFR Part 2 information, not just HIPAA. 6 hours of 12 core functions, 6 hours of HIV and AIDS, 6 hours of suicide prevention, and then the remaining hours are in the 18 categories of competence. These are listed out, so those 18 areas are listed out currently in the 300s. This may be changing in the next year or so, but currently we're still looking at 18 categories of competence and they are listed in the ALC 300s. And then all of this information gets documented on the education and training summary form. One piece that I didn't mention is how much can you take, online? So 25% of your CEs can be online. And what that means is on demand or at your own pace. These are the ones that you can click on and take at 10 p.m. at night. It's a recorded webinar. So 25% of those can be online, on demand. The rest do need to be live simultaneously, such as a training like this, where it's live, we're meeting in person, you have an opportunity to ask questions. And so that's how you differentiate the two there. All right, so some questions earlier about supervision. So this is just a snapshot. So supervision, before supervision can happen, a supervision agreement needs to be filled out between the supervisor and the supervisee and sent into OPLC for approval. This went into effect in March 13th of 2023. And this has also been, because of such a big change, this has been one that we see a lot of questions from our community around. There was a time when this first changed that the board was giving a little bit of leeway, but I think that has halted at this point. So in order for any of your hours of supervision to be approved and go forward towards your application, you need to have that supervision agreement in advance on file with OPLC. Really big piece. I'm going to plug that. Next part, 300 hours of direct and indirect supervised practical training, regardless of degree. So whether you have associates or bachelors, 300 hours of direct and indirect. So that's in person, or it could be maybe your supervisor and you're in a position where you are reviewing charts of your supervisee without them being present. That can be indirect. So a total of 300 by the time application is ready to be sent. A record keeping and note taking by the supervisor and supervisee must cover the 12 core functions and 10 hours of supervision in each of those as a minimum. Supervision is performed in a mutually agreed upon setting by someone licensed by the LADAC board or approved by OPLC. I did see, I just want to pause there. Nick said LADACs with an LCS can provide supervision to other LADACs as well as CRSWs after taking 6 hours of training in the 4 domains of recovery, which has been approved by the board. Thank you, Nick. Individuals eligible to provide clinical supervision to an MLADAC shall be MLADACs who have had at least 2 years of experience in active practice of substance use and co-occurring disorder counseling. Great. Thank you, Nick, for that. All right. LADAC requirements of supervised work experience. So if individual has an associate's degree, it is 6,000 hours of work experience. If bachelor's degree, it is 4,000 hours of work experience. An individual working full-time, about 40 hours a week, equals out to be about 2,000 hours a year. So that gives you an idea of how soon somebody can gain their work experience. It can be paid or volunteer. It needs to be involved in direct service to clients. Hours worked during a college internship or a practicum can count towards these totals. During the application process, you do have to send in a job description, part of your employee verification form. And it is important that includes substance use counseling as part of your job description and or the 12 core functions of a substance use counselor. There is an examination. The examination is the alcohol and drug counseling exam performed by the IC and RC. The fee is $175. There is a wait time of 90 days to retake a failed exam. It is a computer-based exam. And if you go on the LADAC board's homepage, there is a registration instruction form there on how to register for the exam. I'm going to plug in as part of CSP as our program. We are providing test prep. So once a week, we have an individual, we contracted with an individual to provide test prep group to help prepare for that examination, both for the ADC and then the AADC for MLADCs. Code of Ethics, applicants and licensees may sign assurances that incorporate the NADAC Code of Ethics. Just as an update, the case study requirements and 3 professional reference forms were eliminated as of March of 2023 with those changes. Other requirements, we're going to go step by step through these. In the MLADAC requirements, they're very similar. It's just the fees are a little bit different. There is a fee, a non-refundable initial application fee of $100. This is now taken over by OPLC, so the reference is PLC, as you see there. And that actually, they reduced the fees just a bit when they took that over and reprocessed the fee schedule. That was updated in August of 23. And there's a professional's health program fee of $28, which was updated January of this year. Must be 18 years of age, must be able to read and write English, need a notarized form permitting release of criminal background check. Of course, a criminal background check is sent to the board, to OPLC, verification of employment form, supervised work experience form, supervised practical training report form, applicant evaluation form completed by the supervisor, and if you have any licenses in other jurisdictions, a verification of that. So these are all the additional materials that go along with the application. You can find all of these on by going to the board's website, and on the right-hand column, you'll see a section that says applications. You can click on that, and it'll take you to all this information there for future reference. All right. LADAC initial licensing requirements. Any questions about how to obtain your LADAC? I know I already had a few questions in the chat about other credentials. Okay, all right, moving right along. And LADAC requirements. So for education, you do need to have an official transcript of a 60-credit master's degree in clinical mental health, clinical psychology, SUD treatment, social work, or equivalent. I did highlight here with the passing of Senate Bill 44 last year, human services was removed as an eligible degree. That was with the changes of expanding the scope of practice of an MLADC. If the master's degree is less than 60 credits, it must be made up with additional graduate courses. Prior to that change, another reason I highlighted this, prior to that change, individuals who had a master's degree with less than 60 credits could make up those credits by taking other CEUs, such as, those from NHATICA. But with this new passing, it does need to be additional graduate courses. The degree must include a clinical internship. And just like the LADC, 300 hours of substance use education, 25% can be online. Same requirements here in terms of the CEs needed within those 300s. The change between LADC requirements and MLADC requirements is this right here. The 24 hours are needed in the past 12 months. So within the past year, prior to putting in your application, 24 hours of those 300 need to be current. And again, you document those on the education and training summary form. Supervision, again, must have a supervisory agreement on file with OPLC before being able to count those hours. The indirect practical training happens after the after the degree is completed. So 300 postmaster hours. Also, same with if you had less than 60 credits and you went back and you were gaining more credits, the post hours don't happen until you've made up that 60 credits. Recording and note keeping by the supervisor and supervisee must cover the 12 core functions with a minimum of 10 hours in each core function and be performed in a mutually agreed upon setting by someone licensed by the LADC board or approved by OPLC. Supervised work experience, 3,000 hours. Postmaster's experience must be postmasters. Paid or volunteer must involve direct service to clients. If you have a LADC, so if you already hold the credential of a LADC, you only need 1,500 hours postmaster's experience. Also 1,500 hours postmaster's experience. If you have an LCMHC or LSCSW, it is recognized that your work by obtaining that licensure can be utilized for 15 hours so that you cut in your work experience in half there. Make sure, again, that the job description includes substance use counseling, 12 core functions. The examination is the AADC, which is the Advanced Alcohol and Drug Counseling Exam by IC and RC. Again, it's a $175 exam fee, computer-based. There's a registration form on the LADC board's homepage. The Code of Ethics follows the NADAC Code of Ethics, and same as LADC, the case study requirements and 3 professional reference forms were eliminated last year in March. The changes here with other requirements that are different is just the fee. The application fee for the MLADC application is $212, which was updated in August of last year, and then the $28 health program fee. The rest remains the same. Any questions about initial licensure as an MLADC? Alrighty, moving right along. All right, so requirements for renewal. There's a lot of changes here. Well, a lot of changes, some changes, depends on how you look at it. We're going to look at the changes specific to LADC and MLADC. Requirements for renewal. This is maintaining these credentials. You'll find these in the AL 400s as recently mentioned. These, I'm going to be following the newly adopted rules. I have highlighted some of the changes so that you'll know what the changes may be. For a LADAC who wishes to renew their license, they need to comply with certain supervision requirements, or if applicable, the peer collaboration requirements. And that's what Pete was referring to earlier. There was a time period where there was a switch, and individuals who fall under a certain area of that time period who were LADACs in private practice, they can continue with peer collaboration. That is that if applicable part. Comply with continuing education requirements. This little bit is going to be new. Complete and submit a universal application for license renewal required by PLC, and then the LADAC and MLADC addendum to the universal application for license renewal. These are going to be new forms that will need to be filled out. Pay the renewal fee. Again, the renewal fees, all fees were reduced just a bit when OPLC took those over. The renewal fee is $100, and then also the professional health program fee of $28. MLADCs who wish to renew their license shall comply with peer collaboration requirements and, if applicable, supervision requirements. Again, there's this new form of the universal application license and the LADAC and MLADC addendum to the universal application for licensure renewal. If you're chosen to be audited, you need to be able to provide documentation to be in compliance with the continuing education and supervision or peer collaboration requirements. There's a fee. This is different from LADACs. It's a fee of $212. And then also the professional health program fee of $28. Speaking towards peer collaboration requirements. So peer collaboration requirements can be found in the ALC 408 newly adopted rules. These requirements apply to LADACs in independent practice before July 1st of 2008 and MLADCs. The requirement is 26 hours of peer collaboration in a 12-month period that begins on the date of the issuance of a license or renewal license while actively practicing. So by the time the individual renews their license, you have a total of 52 hours. This can be performed, peer collaboration can be formed in person or by teleconference and take place in a small group setting of 8 or fewer individuals. So that's very important to know. Peer collaboration and supervision as a group needs to be 8 or fewer individuals, or between 2 or more individuals related as peers. Documentation requirements. Licensees document each instance of peer collaboration. That includes the date, names, licenses held by each participant, and the duration stated in hours and minutes, which is signed by each participant. So the document needs to have date, names of each person that's part of it with their licenses, and the duration in hours and minutes. Licensees are to retain this documentation until they're required to submit them to OPLC. This can be part of a renewal or at any other time that is requested by the board through OPLC. So no timeline is given. It just says retain the documentation for if and when an individual is required to submit them. All right. CE renewals. All right, CE renewals are going to be the same for LADACs and MLADCs. So per the newly adopted rules, these are ALC 40902 and 40905. These go into effect again in October. 48 hours of education every 2 years. At least 50%, 24 of the 48 hours shall be pre-approved. When you go to the rules, it does list out the pre-approved entities, so you can see where they are pre-approved and what could be utilized. No more than 12 of those 48 hours shall be received in online continuing education courses. So again, those are the webinars that you can do on demand at any time. There's no one to converse with or chat with back and forth. And 12 hours need to be specific to the 7 listed categories of competence. And I listed those 7 here. So 12 hours are specific in these 7 categories. No more than 12 can be in that webinar online situation. and half of them need to be pre-approved. Do need 6 hours of ethics, 6 hours of suicide prevention. May substitute up to 10 hours of CEs for an equivalent amount of time as a presenter of CE courses. All documentation, this is an important one, all of CE documentation must be kept for no less than 6 years. So all of your CEs that you're accumulating and that you're utilizing, you need to keep the documentation for no less than 6 years. All right, supervision requirements. I do see a couple of questions in the chat. I'm going to keep going, and if I don't get to answer your questions now, like I said, I'm going to pull together those and create a document later to send out to folks. But given the time, we got 10 more minutes, got a couple more slides to go through. I want to keep going. So required supervision of a LADC by one or more supervisors. As described here, we'll look at those in 40503. At least 1 hour a week while actively practicing. So formally, it was written at least one occasion a week. There wasn't a time given. However, that has changed. It will be 1 hour a week while actively practicing. Those eligible to provide clinical supervision to a LADC are MLADCs who have had at least 1 year of post-licensure experience in active practice of substance use counseling, LADCs who have at least 2 years of post-licensure experience in active practice or substance use counseling, individuals not licensed by this chapter, so those who are not credentialed by the LADC board, can seek approval through the ALC 400 rules. Supervision types and hours. So clinical supervision of LADCs can be one-on-one or in a group setting with no more than 8 supervisees and the supervisor. So it needs to be 8. If there's more than 8, you need to seek a different group, 8 or fewer. The minimal number of hours of clinical supervision per week shall be at least 1 hour per week while actively practicing. And this change is they removed the for at least 48 weeks. So prior to the change, it did state 48 weeks of supervision, and they have now changed that to be 1 hour each week that you're actively practicing. Now we're going to move on to supervision of MLADCs. So the clinical supervision of an MLADC, or who is a candidate for initial licensure, by one or more supervisors meeting the description of 40602 in a setting and for the number of hours each week as described in 40603 that we're getting here in a second. Those eligible to provide clinical supervision to an MLADC. Individuals eligible to provide clinical supervision to an MLADC or candidate for licensure as an MLADC shall be an MLADC. Individuals eligible to provide clinical supervision to an MLADC or candidate for initial licensure shall be an MLADC with at least 2 years of post-licensure experience in active practice of substance use and co-occurring disorder counseling. So 2 years. Individuals not licensed under this chapter shall be approved supervisors pursuant to 407, which we'll get here in a second. The supervision types and hours. So MLADCs, when it comes to renewal, they need to have a total of at least 26 hours of peer collaboration per year with a total of 52. It can be clinical supervision per year in an individual or small group setting if no more than 8 supervisees and supervisors, or peer collaboration, as we earlier mentioned. There are obligations. Newly adopted rules specify even further the obligations of the supervisor and the supervisees. Here we're looking at the obligations of the supervised LADC and MLADC. They need to give a copy of these rules to their clinical supervisors. The supervisee needs to maintain records and dates of the hours they receive clinical supervision with the name and names of the supervisor, and on the basis of such records, prepare a cumulative statement containing each of the following. For each week identified by calendar date, number hours of supervision received, the number of hours of supervision received, their credentials, printed names, signatures of the supervisors providing the clinical supervision, and the date the statement was signed by the supervisors. The printed name and signature of the supervisee preparing the statement, and the date of the signature. These records of supervision need to be held onto for no less than 7 years after the termination of the supervision. So if you were in a supervisee relationship, both parties, the supervisor, supervisee, need to maintain these records for no less than 7 years after the termination of the supervision. Supervisors just kind of piggybacks on what was just the obligations of the supervisees. Need a copy of the board approved letter from OPLC of the supervisory agreement. Need to be familiar with these supervision requirements. And if there is any time that the supervisor is unable to perform supervision, that they ensure a substitute supervisor who meets all of these eligibility standards is available to continue supervision. They need to maintain the records and dates and hours they provided supervision, just like we went over with the supervisee's obligations. Again, needs to be kept for no less than 7 years. The other obligation of a supervisor is here in D, be subject to disciplinary action if they fail to meet their responsibilities under RSA 330C and the board's administrative rules. And like I said, maintain all supervision records for no less than 7 years after the termination of the supervision. So you have 4 minutes left. The next little area is just going to go over if somebody is not credentialed, does not hold a license under the LADC board, and they are looking to supervise somebody who wants to be a LADC or an MLADC. They will need to go through an approval process. They need to fill out the approved supervisor application form and submit that to OPLC prior to providing the supervision. Evidence of a successful completion of the IC and RC exam. They must pay a fee as required by the fee structure that OPLC put out. It can be found at PLC 1203. Shall retain their approval status by maintaining active status for the New Hampshire license upon which they receive their supervisory approval. So they must maintain active licensure with their whatever board it is that they're originally licensed under. And then OPLC maintains a list of these approved supervisors, and that list can be found on the LADC board's homepage. There is a list of eligible supervisors that are not already licensed under the board. All right. I see Nick's been in the chat answering questions. I got about 3 more minutes. I wanted to plug CE Broker before we end today. So OPLC has implemented a new process of renewals, and it is a third-party contracted entity called CE Broker. There is a stakeholder meeting that is being held, as you see down at the bottom, have little arrows there, on September 30th at 2 p.m. for alcohol and drug use professionals to learn more about what CE Broker is and what we're going to be required to do with CE Broker. We have been trying to follow this for the last month or so, trying to understand the process, and we're hopeful by NAHADCA's team members are hopeful by attending this meeting. We'll have more updates on what this looks like, but you can go to the OPLC website and look in under CE tracking, and you'll come to this CE Broker website to learn more for yourself and or register. We'd really like for people to register, learn about it so that you know what it all entails in terms of continuing education requirements for our profession. All right, so I'm going to stop screen sharing. That is going to conclude the presentation today. Carissa, I don't know if you had any follow-ups or last minute things to say before we end today, but I just wanted to thank everyone for being here. I know it was a lot of information thrown out at once, and I hope that you're able to learn some new pieces, understand some new things, and if this brings up more questions, please feel free to outreach anyone on the Credentialing Support Partnership team, and we will be happy to help you with those.